Hi, everyone. So I think we're on, right, Amparo? I'm not
I,
sure. Okay, how are you today?
it's been a long week, but feeling good after the debate yesterday. Like,
Good.
good job, Kamala. Holding it down.
Yep, yep. I didn't watch it, but I saw the highlights.
The highlights, the fly with on Mike Pence's hair.
Yeah, and then when she told him, like, I'm talking, or, she had to stand her ground.
It's true. She really. I mean, it was beautiful to see
Hmm.
um, the history being made right yesterday. Um, the comparison of having someone who's worked so hard to
Hmm.
be there,
And so
and
prepared.
then yeah, yeah, and how it she just was spot on with her responses. So
Yeah,
yeah,
I think it's so different to see like a woman of color on that stage.
yeah, it is. It made a huge difference. I think she it was also interesting the sexism, right, that was there. So
Oh yeah, for
yeah.
sure. So today's talk, we wanted to focus on the conversation around Medicare and Medicare for all. And I think this is an issue that, a lot more people are cognizant of and talking about because of COVID-19 and the pandemic. But I think it's an issue that, a lot of our families in our communities have been dealing with for a long time and have been struggling with for a long time. And so, I think we just wanted to take some time to, talk about it and talk about it, how it's affected maybe our families, and also, some of the big picture like issues with the Medicare system, the medical system, the things that we are focused on, the investments that are made by, our tax dollars. So, what are your thoughts today, Amparo?
No, I think you're absolutely right, Aida. I think that there's an intentionality in having this conversation this week. I think we each day that we're living feels like it's a year, right? And
Mm-hmm.
so less than a week ago, we heard the news about the president and tax returns, the $750 that he paid, but more importantly, also what he owes, right? And those questions. Um, then we have the debate that happened, um, and between Donald Trump and between Joe Biden. And I think the heaviness that everyone felt after that debate, right? Because that has been the past 4 years
Yeah.
where no one can get a word in. You can't even process your thoughts because there is someone who is so unprofessional, so unpresidential, who doesn't have like human decency and who doesn't have an argument, like an actual factual based argument. So he's just
Yeah.
fighting, right? And so, how do you fight with someone who's just saying nonsense in an environment where people are trying to process that, right? And after that, we get the news. And actually, even before this, right, we had just gotten off of um, Justice Ginsburg passing away,
Yeah.
honoring her life and everything that's happened and how much she's done for us. Um, uh, so we have so many things happening,
Mhm.
and the big thing for me of why we needed to talk about Medicare for all today is because Donald Trump was diagnosed with COVID. right? At least that is what they tell us happened. He was diagnosed with COVID. I don't see a reason as to why they would lie about him having COVID, right? Although there's a lot of conspiracy theories, right? There's a lot of conspiracy theories.
Yeah.
So, and I think it's an important conversation for the community to have, because the messaging around who has access to healthcare and who doesn't looks so different. So with Medicare for All, it's a really important conversation to have.
So going back to our conversation about why it's important, like why we wanted to talk about healthcare and you know, about the recent one, we're in the middle of a pandemic still. In the last week, there's been reports about, you know, half of the White House administration contracting COVID. And to me, it's just really a slap in the face, you know, like the World Health Organization, all these, you know, doctors, scientists have said that wearing a mask reduces like the transmission rate, right? And so then you have this administration who very strategically and you know, made it a political issue to wear a mask, and made it a political issue to acknowledge the seriousness of the pandemic and the fact that, you know, so many people have died and have contracted the illness, and then they contract it, you know. And to me, I just feel like it's such a international embarrassment and a national embarrassment for him to then go on Twitter and say and tell people not to take this serious, and, you know, not to be afraid of COVID-19. I think it's just so evil, you know, when you just look at not only like who are the people who are contracting it, but also the lack of medical care and the lack of medical resources that the people who have it, you know, have gotten. And so I think it's really highlighted like the ugliness of our medical care and our medical health system, and the huge disparities in, you know, in the way that we provide these services and even just talk about health. What do you think, Amparo?
Yeah, I think it was so important to talk about this topic today in this moment of time, because there's a couple of things that were very triggering last week, right? And I think you're absolutely right when you say that this was a slap in the face. And the reason why it's a slap in the face is because continuing our conversation about what we're talking about, there are so many people that every day try to do the right thing, right? And I was thinking about this, right? When we have a disaster, when we have something happen, as Americans, we're not asking like, are you a Democrat? Are you a Republican? Are you an independent? Are you Green Party? We just help, right? People help people, and you try to do right. And people are trying to do the best that they can in the universe that they have, right? And we need to talk about the fact that undocumented Americans have been paying taxes for decades. They're subsidizing our Social Security system for people when they retire, without being able to get that benefit themselves. They're trying to do everything that they possibly can do to do things right. And there are also people that are working class, right? Who during this pandemic, even though they have had incredible anxiety about having to go into work, because if we go back to March, that's when things kind of started to hit the American public, even though our president and the Republicans knew about this back in January, perhaps even back in 2019. the reality was that as Americans, and I will even put myself in there, it wasn't until March where I was like, whoa, what is actually happening?
Yeah, me too. Mm-hmm.
What is actually happening? And I think we all have family members that had to continue to show up to work because they were deemed essential.
Yep.
And so as we talk about Medicare for all, it's in this broader context about how we are actually treating the people that are actually ensuring that our economy, our day to day, and everything continues to run. And to see Donald Trump receive the best healthcare coverage, I was thinking back to March when I had a scare, right? My mom, I told you about this, didn't feel well. This was very early, and we're like, oh my gosh, what if she got COVID, right? Yeah. And how scary that was for our family. And we have health insurance. Yep. We have health insurance, but at that time you were being told, don't go to the hospital. And at that time we were being told, do not wear a mask. And it's not because masks aren't helpful, but because our federal government failed to institute production so that our essential workers, doctors, nurses, and everyone out there could have the PPE that they needed. So as Americans, we were being told, like, do not wear this mask because that needs to go to those doctors and nurses and people who are at the front lines. We are the United States of America. What the hell went on where
That's embarrassing.
Where we as people are allowing a presidency and a Mitch McConnell run GOP to be able to tell us what is cost effective for us to have and what is not, after they provided trillions of dollars of free money to people who have generational wealth, not people who are self-made, not people who are middle class, but people who have generational wealth. Our paychecks, our tax dollars are paying for it. And so I'm giving this context because the very first thing we get told, right, for those of us that are in this fight around Medicare for all, it's that we cannot pay for this. Yeah. How do we pay for this? How do we not? Well, how do we pay for corporations to receive tax credits, right, when they do business? How do we pay for different industries like private jails? Yep. To be able to have the dollars and stocks that they need to make people incredibly wealthy. Yeah. How are we paying to have a president get the absolute best subsidized healthcare when he only paid $750 towards that, and in other years paid $0? So I got a little fired up with that. What do you think?
That's good. You should be fired up. I mean, I think for me, it's just like when you think about our society and like our world, right? Like we can't do anything without health. Like to me, that's just like a basic human level, like necessity that we have. And I think, when we talk about how we prioritize funding and the fact that the Republican Party has been fighting like the ACA for so long and want to take it away from and want to chip at it, as much as possible. To me, it's just like, you should be fired up about this. Like, I think it's just, it just shows like the greed, I think the greed over, pharmaceutical companies and like the corruption inside the medical care system. And so I think to me, it's just like, it's hard for me to comprehend that we're doing that to people.
And it should be because there's a hypocrisy, right? And I'm glad that you brought up the ACA. So For a lot of people, they won't remember that just a couple of years ago, if you had a pre-existing condition, and let's be frank, being a woman, according to these laws, is a pre-existing condition, right? Yeah. Before the ACA, people were denied life-saving coverage because they had a pre-existing condition. Mm-hmm. And that is important to hit on because we know through research and data that the communities most impacted by these pre-existing conditions are communities that are disproportionately Black and brown, right? And communities of white Americans who have lived in poverty. Mm-hmm. And it is because those communities have not been invested in with parks, with not having toxic industry placed next to them, with not, with not being able to access clean air, with not being able to have fresh fruits and vegetables near them instead of liquor stores, right? So it's like, as we plan what our communities have, we know that investments often go to the places that are the wealthiest and where people are, it's so thought of as like, well, this is where investment should go. And so when we think about healthcare, people were being denied. And so what this meant is that people that could have had preventive measures weren't able to get it. People here in the San Joaquin Valley who had valley fever were not able to get, it's literally, there's a medicine that can mitigate these issues, but instead of being able to get it, people were having to go on dialysis. Mm-hmm. And so when we're told like, oh, well, how are you going to pay for that? My question is like, how can we be okay with paying the costs mm-hmm. that our communities are incurring today? Because there is an emotional cost. There is a job cost where we have, when we have to take time off work and care for our family members, there's the cost to our health, right? As to dying younger because we are worried about, having a disease or someone getting sick and what that means. Yeah. The psychological, mental health costs. And there's also the cost that is enriching so many people in the current way that healthcare is run, which is it costs the federal government, our state governments, our local governments, so much more to have people go to an ER room, which, by the way, the ER room, it's a legal standard where it's not to cure you. It is to get you out of that emergency situation. Mm-hmm. It is so much more expensive to pay for that than to have early on provided healthcare coverage to people. So I push back on the cost portion because yes, healthcare is expensive, but as a society, we need to be talking about what are we willing to invest in? And like you said, if you don't have health, you don't have anything, right? So why are we being told as communities that we shouldn't have access to healthcare and how much it's going to cost by those who have some of the best healthcare out there in our entire country?
Yeah, and I think that the point that you're making too, Amparo, about these external conditions, I feel like the talk around good health, in my view, has always focused on individual actions. When they talk about like, oh, es que los Latinos pues comemos mucha carne, or like we don't exercise enough, like we don't do this and that. And I think it's going back to like this like individualistic way of looking at healthcare, right? And it's like, okay, that is one portion of the equation, but also like, I grew up in Southgate. Like, I mean, we had one park for the entire city, which was packed all the time. We had like a bunch of industry. We had like Firestone tires on like the main avenue. We didn't have bike lanes, we didn't have access to healthy food. Like, when I got older and I wanted to like buy healthy food, I had to go all across town. And so I think nobody talks about how these like cities are designed, you know, how these decisions are made and the impact that that has on people's health. You know, the fact that we have, you know, pollution, longer commutes, all the stuff, right? When I think, you know, it's like we blame ourselves. Like, oh, it's my fault that, you know, I'm not healthy, or it's my fault I got sick. You know, in my family, like my mom got cancer maybe 5 years ago. And I strongly believe that the reason she got cancer was because she worked in factories most of her life. And because we lived in Southeast LA, where there was a lot of industry, you know, just like nasty, nasty companies. And I always thought, you know, when we were going through that, I was like, why? Like, why did she get cancer? And it was like, she was like very healthy, very active, always ate right. You know, she did all the right things. And obviously like we lead more stressful lives, you know, as like working class families. And so to me, I think it's so important that you highlight that point, because I think sometimes our communities don't know that and don't realize the design of these things, like these external factors, you know, that you're talking about, like social determinants of health, and what an impact that has outside of just like the medical health industry and like the preventative measures that could be happening.
Yeah, and it's so true, Aida, because like here's the thing. Right now in this pandemic, you continue to have people who are showing up to work, to different places, and they might not have healthcare coverage.
Mm-hmm.
They might not have healthcare coverage. Or you have people who were let go of their jobs,
Mm-hmm.
and their healthcare coverage was tied to having employment based.
Mm-hmm.
And so there needs to be a reckoning, right? Where people that are making these decisions behind closed doors at a policy level, who have access to healthcare, who have access to the best technologies, who are spending trillions of dollars
Mm-hmm.
on a system that doesn't make sense and have been fighting for a decade against the progress from the ACA,
Mm-hmm.
it is ridiculous, right? So when I think of our leadership in the Central Valley, and I think about the fact that, you know, let's get real, the ACA is a market-based approach.
Yeah.
It is a Republican-based approach
Mm-hmm.
brought forward by a Democratic president.
Mm-hmm.
The Democratic approach would have been at that time single payer, right? Which single payer is like everyone gets access to healthcare. This approach was market-based.
Yep.
And yet, because of the racism in their hearts and the racism that is inherently within the structures of our society, we have spent now close to a decade tearing down. You know, it hasn't actually been a decade that the ACA was implemented, but still, you get what I'm saying, right? Yeah. We have spent all this time arguing about a policy which has increased healthcare coverage,
Mm-hmm.
but it was just a start, right? Affordable was affordable under a term that is legal. It is not affordable under what everyday people experience.
Right.
And instead of expanding healthcare coverage, instead of making it better, instead of ensuring that every single person in this country has access to healthcare, elected officials from the GOP have spent their careers taking healthcare away from people who have disabilities,
Yep.
people who are like your mom and were diagnosed with cancer through no fault of their own, right? Because of the conditions and the environment that they live in, and who are just trying to do everything right, and yet they are being told that they cannot have healthcare coverage because it's not affordable, or it's not something that's doable.
Which is complete BS.
It's hypocritical. It is.
Yeah. And so I think, when you hear, like the politicians running for office, especially at the federal level, yeah, they talk about, healthcare is one of the issues that everyone is concerned about. And I think they make a lot of promises. And I think, like, from my view, I feel like it's become such a like a wedge issue, but I don't feel like anything's actually progressed since then. And so I guess I'm curious, like, what do you think like should be the response from communities, especially like right now, right? Like, to me, it's really depressing, like at the beginning of the pandemic when people didn't know where to go get tested. Like, where could they get tested if they don't have insurance? Like, who's going to pay for that? What if they don't have status? It's like, this is a public health crisis, and people have to be concerned about being able to pay for a test. Like how do we elevate this issue, like during this pandemic, during everything that we've lived through, all the families who've lost a relative, to this pandemic, like, you know what is really the way to hold, like, Congress accountable and people accountable?
I think, Aida, that the community needs to start believing and owning their power,
Mm.
right? Because these laws are meant to be confusing. The system is designed to not be accessible to people. It is confusing. There's so much information happening. There's different hearings that take place. You're made to feel as a community member that, oh, just sit down because you don't understand the intricacies and how complicated and the policy making and the costs and so forth that go into this. Well, quite frankly, I don't think administrators and elected officials actually understand this while they're telling community to sit down.
No.
Because if you look at hospital bills that come in, depending on who you are and when you've got in, I don't think anyone actually knows how much does it cost, for example, to even get a Band-Aid. Like,
Yeah.
what is the cost, right? Because
Yeah.
if you have health insurance, your insurer might be charged X amount. If you are getting that Band-Aid when you're going in through the emergency room, it's going to cost you something else. If you're going in through the non-urgent care portion of like a medical system, it's going to cost you something else. That is a problem.
Yeah.
That is a problem because in the world that everyday people live in, if you go to a Walgreens, if you go to Target, if you go to the dollar store, there is a price for that Band-Aid, and it doesn't matter if you arrived in an electric vehicle, in a scooter, walking, or however you came in, right? And so the first part is community needs to own their power and not feel like an imposter, because what's actually happening is you're not incorrect. The system doesn't make sense. The
Yeah.
system doesn't make sense when we can't even determine as a nation how much a Band-Aid will cost
Mm-hmm.
and how much you're being charged for it if you go in through these different mechanisms. It's the silliest thing ever.
Yeah, I remember I went to the doctor like 2 years ago or however long ago, because I never go to the doctor. And finally, talking about healthcare, I've gotten better over the years, but initially it's like, no, I'm never going to the doctor unless, I don't know, there's an emergency. But the doctor asked me to get blood work as just like a general physical. There was nothing wrong with me. I just, she wanted me to get blood work. So I finally, like, take time off from work. I go get the freaking blood work, all the stuff, which by the way, I need to go again. But I go and then I get a bill for $500. And I'm like, what? I have insurance. Yes, my insurance wasn't the best, but I had insurance through my employer. So I'm like, what the hell? So then I spent 6 months fighting them on this bill. And I'm like, okay, this is a preventative healthcare measure. I didn't need the blood work. I did it as part of a physical and stuff. So then I get into it with the billing department. The billing department's like, well, the thing is, it was billed as an inpatient like procedure or something. I don't know. It was the code they used when they billed it that made it seem like, you know, because I did it at the hospital and there was some kind of technicality. And here I am, like, I'm an attorney, you know, I have all this education. I speak English. I'm a peleonera, you know, I'm not paying $500, even if I have $500. So then I'm like, okay, well, I want to appeal it, you know. So then they're like, you have to have your doctor resubmit the order. Then billing has to redo it. I spent 6 months fighting them. I wrote letters, you know me. I'm like, I don't give a damn. I'm gonna fight it. But I'm like, okay, like I'm here trying to like be proactive about my health. Imagine all the families that, you know, get these bills that don't have the time or the patience or even the knowledge of how to fight these bills. They'll go into debt to pay these bills, or, you know, they'll go into collection, which, you know, like could really affect a family. I mean, and I think about like how confusing and difficult it is to even navigate the healthcare system itself. I mean, I just think like this is such a problem. Like this is not, you're already starting on the wrong foot when it's all about like the billing and the medical system and the money, you know, and all that. And it's an industry, it's a business. It's not about how can we keep people healthy.
Mm-hmm. And you're right about that, because at the end of the day, it's not really about cost savings. Because if we were talking about cost savings, it would be make sure everyone has access to healthcare, and then make sure to improve those systems so that when people interact with healthcare, they have a positive experience, right? And you have healthier communities.
Mm-hmm.
The problem, Aida, that is happening in communities, and that's happening throughout, is that it doesn't feel like people can have the power to change things, right?
Mm-hmm.
But that's the thing. We have to own that power, and then we have to push forward, because if we go back to pre-ACA time, like I mentioned, people
Yeah.
with pre-existing conditions couldn't get healthcare. After the ACA, people with pre-existing conditions had healthcare. There was still, and in California, there was such an increase because of community efforts and people getting involved, of people being able to finally become eligible for Medi-Cal, right? And for the first time being able to have health insurance that, because of the ACA, has specific protective measures and isn't just junk insurance, right? Because maybe people beforehand were paying, like, let's say $20 for healthcare, but that healthcare actually didn't cover anything,
Yeah.
anything at all, right? And you get to a point where we are now in a pandemic, and the president of the United States is having our tax dollars, because he's not paying taxes, right? Our tax dollars paying so that our highest legal counsel in the land is out there trying to dismantle the Affordable Care Act,
Mm-hmm.
instead of trying to make things better, right? And because there's so much that can be improved, right? What about seniors who need access to dental healthcare coverage, right? Oral healthcare coverage, who maybe worked their whole lives in factories, worked their whole lives like in doing the right thing, trying to save up, trying to do what they could, right? They reach their senior years, they might, if they're lucky, right, they'll get access to Medicare. There's a lot of people that are left out, right? But if they're lucky, they'll get access. But they still don't have access to actual robust oral coverage. And I say robust because, yes, you might get a dental plan, but if you're a senior, there's so many gaps there, right? But in California, just a few years ago, Aida, children who were undocumented were not eligible for healthcare coverage. And I think that this is important to know, and for Medi-Cal, I think that this is important to know because a lot of people, and we talked about this in our last Pláticas, right? We're really surprised about the cruelty of the Trump administration, the cruelty of Stephen Miller, the cruelty of these attorneys that have been charged with upholding the Constitution, but who have been like flagrantly like disregarding it, in saying that infants should be separated from parents, right? In separating families. And to me, I'm shocked that people are shocked because I'm like, where have you been?
Yeah.
Welcome.
Yeah.
Welcome, you know? Will you do something now? Will you use your power? And in this system that we have, it takes all of us. And it doesn't mean, Aida, that I'm like, oh my gosh, I love these elected officials so much. I love this, whatever it might be. But you vote if you can. And if you can't vote, make phone calls.
Yeah.
Door knock, you know, in a pre-COVID area. Text, right? Reach out to someone like, Congresswoman AOC said, that only you can reach, right? To have them vote and vote in a way that will protect communities. And so in order for this to change, in order for us to have Medicare for all, it doesn't mean that if we elect Joe Biden, it'll happen. It means that we as people need to own our power and push for it to happen. Push for the investments as to what we value as a society get funded. And those that are perpetuating some of the worst human rights conditions that we are seeing, right, get defunded. And so sending the money that is being spent so that private detention centers, which are actually torture, right, get defunded and people actually have their constitutional rights upheld, I think matters.
Yeah. I think you're absolutely right about that. And I think that there's so much going on right now, and it feels like, at least for me, it feels like we're constantly on the defense and we're constantly on like alert and just like waiting for the next worst thing to happen, because it feels like it's been one thing after another. And I think the struggle and the fight for equality and equity has been going on for, before me and you were born and before our parents were born. But I think that I've been feeling like, folks who've been doing this work for a long time are burning out, and they feel like there's too much up against us. There's too much to fight and advocate for. And I think something that you and I try to convey to people, it's like, this is long term, and we need to have more people join the fight and have more people voice their concerns. And people, you don't have to be an expert. You don't have to read, like policy. You don't have to be a lawyer. You don't have to be educated, all this stuff. It's like, we have real life experiences of all these injustices and all these problems that are going on in our own lives and families. And we can use those experiences to really, like, like you said, like own our power, own our voice, and own our experience to advocate for what's best. Because I think that's something that really irks me too, aside from the corruption part of the medical care system and politicians and what we've been talking about, is like, some groups who are like, or some folks at the table who are like, this is what communities of color should have. This is what these individuals need. This is like the approach that we need to take. And it's like, well, like our communities have this real life experience, knowledge, and expertise in terms of how do you um like I was thinking about the promotoras, like model and what they do, and then I was thinking about like when I went to Cuba on like an educational trip, and we met with a bunch of other doctors, and their community, their level of healthcare is so like community driven and just like on the ground, and so I think that's also another level of injustice and inequity that I see in the healthcare system in terms of, cultural competency and just how to really elevate the voices of our communities.
Yeah, it's so true because you have different things at play there, right? It's people being told you do not have the experience, education, the whatever to be able to speak on these issues when it's like you feel these issues, you
Yep.
live these issues. Like, don't tell me that, like someone who is in the community cannot speak
Mhm.
to what are the issues with a system that leaves so many people out when they live it, right?
Mhm.
People are right now potentially, diagnosed with COVID and they don't know where to go,
Yeah.
right? Or they're like, well, I'm going to still show up to work
Yeah.
because you have an employer that is requiring you to work in unsafe conditions, and that might be it. But I really want to talk about another segment of the population, a segment of the population that thinks, well, I have healthcare coverage, I
Mhm.
have work, right? Why should I worry about this? Like, I have other things. This doesn't impact me, like, blah, blah, blah.
Mhm.
Well, unless you're Jeff Bezos, it impacts you. It impacts you because a cancer scare, a scare with getting a chronic disease, you getting disabled, right? That bankrupts people.
Yep.
And this whole splitting of us versus them, like, no, this is all of us. This is all of us. Improving our healthcare system is going to take all of us. It's going to take everyone saying what they actually need and what we want this to look like and how it's going to meet the needs of our seniors. Because it is bullshit, Aida, that we have a system right now where we have seniors who are out there having to do essential services. Like, there was this feel good story about this, over 70-year-old man who was delivering pizzas. And I'm like, that is not a feel good story. And how he got like a big tip. That should horrify every single person. And here's the thing, I think it does horrify most people
Mhm.
that we have a system set up where we do not value our elders, where we are not taking care of one another, of our neighbors and everything. And I know it because when disaster strikes like a fire, like we've had these fires in California, people show up, people donate, people show. So I know that this doesn't sit well with Americans. The disconnect happens with how do they then engage with the system that has all these intricacies and is designed to keep you out of it. And I think the way that you get involved is you elevate your story,
Yeah.
you make sure your voice is heard. And if what you can do right now is write a letter, if what you can do is send an email, but send it to your elected official. Don't send it to, if you're a Californian, don't send your letters to the representative of Arizona. They want to hear from their constituents. Don't send your letter if you're from California to the representative in Maine. They want to hear from their constituents, right? But if you're a California and you have family members in Texas, in Arizona, in Maine, in Florida, you can call that family member up and encourage them to start taking this seriously. Because unless you are Jeff Bezos,
Mhm.
if something strikes, we are all at risk. We
Yeah.
are all at risk of losing what we have worked for, should a healthcare scare happen. And so we shouldn't just do it because we're scared, but we should do it to be empowered because we're imagining communities where people aren't, like right now, we have over 200,000 Americans that have died.
Yeah.
200,000 Americans, people who had hoped to be able to go to the hospital but were turned away because there wasn't capacity, people who would have wanted to go to the hospital but couldn't go because they didn't have health insurance, people who have lost their parents, their dads, their sisters, their brothers, their aunts, their cousins, their kids to this pandemic, but could not access the same medication that the President of the United States received, even though the President of the United States has been criminally negligent in giving the American people false information, which has led to people not even taking basic precautions, which would have saved lives, like wearing a mask, washing your hands, maintaining social distance. And instead, this jerk is talking about doing a rally. He has no backbone. And when we start to call out his weakness, because a lot of people call him like all of these things, oh, no, we need to call out his weakness and his failures. And he is weak.
Yeah.
He is weak. McConnell is weak. He is not this sly, smart individual. McConnell is weak. Susan Collins, who has not had a, she is weak. But it is going to take all of us saying what we need in a healthcare system, what we need for our loved ones when they go through something like cancer, and then fighting for it to make change happen. And now in California, we have a healthcare for undocumented children, something we didn't have, but it's still not enough. We still need to do more.
Yeah, and I think like it's like from some families, like I don't even think we realize the disparity. You know, like I remember when my mom first was diagnosed, she didn't have healthcare. And so we enrolled her in Medi-Cal. And then apparently, you know, they were like, I don't know much about, like, I don't know how it works still after all these years, but there's like two versions of it. She needed an unrestricted one to get into this like really fancy hospital that we knew was going to help her, right? Well, initially she got sent to county. And I mean, it's like you go to a county hospital in Los Angeles, it's like a third world country. And then you go to this private, you know, for-profit. When we were finally, after fighting all these administrators and all the stuff, we could finally get her into an unrestricted Medi-Cal program. I really feel that saved her life. Like when we went to City of Hope, which is the hospital she eventually was treated in and got better in, it was like night and day. You know, and it really pissed me off, like at that time. I'm like, this is not right that like our families have to go to this hospital where they don't even have the right equipment. They don't have like, you know, enough like even doctors. They have, I mean, they're trying their best. It's not like I'm not attacking the doctors, you know, a lot of them were still residents and students. And then you go to this other place where these doctors have publications, they have grants, you know, they have trials. Like it's just, to me, just living through that experience, to me, it's just like, fuck, this is really bad, you know? Like I don't like to cuss, but in our webinars, but it's just like, you know, you just, I mean, it's so blatant. It's so blatant, like the disparity and the way that we treat like different people because of all these problems that we're talking about. And I think you're absolutely right. Like we need to hold these politicians accountable. We need to hold, you know, Donald Trump accountable. We need to, well, you know, hold the Republican senators accountable and anyone who's fighting against, you know, Medicare for all, because it's just so, to me, it's just like something that is really hard to comprehend, even though I have all these experiences and I read and I understand and I see it. It's just hard to comprehend like the level of greed and, like you said, like criminal negligence, you know, against providing like adequate healthcare to people.
Yeah, I mean, whether someone lives or dies should not be determined by whether they have access to healthcare or not.
Yeah.
Like the fact that we make it a question, the fact that we make it seem like it's something that's a want versus a need, it's bullshit, right? It's not right. It's, and especially it is hypocritical coming from a party that calls themselves pro-life,
Oh, yeah.
right? Because what they have done is set up a system that is hurting people, right? And so the reality is we have to talk about Medicare for all, not as if it's an impossible, not as if it's like a reaching for the stars type of proposition.
Yeah.
It is today. We have in the United States medication, therapies, interventions that can save lives. And we are denying people access to those life-saving things because they might not have health insurance, or they might not have the right health insurance, right? And that's just wrong. And at some point, people have to start taking responsibility for that. And if they're going to write policies which are forcing people to show up to work, you better also be writing those policies that are making sure people have access to healthcare. And so it drives me crazy that under this federal government, we have been for 4 years fighting to save the Affordable Care Act instead of in a pandemic making sure that people have access to healthcare. I'd like an accountability of how much money has been spent to fight this. How much money has gone for Donald Trump to go golfing? How much money has gone for him to do his little joy rides while he has COVID in a car that is exposing
Other people,
everyday workers and public servants, right, who have dedicated their lives to this country. And so it's about respect, it's about decency. He has none of that. And so instead of talking about Medicare for all as if it's a crazy idea, I think it's time that we all start talking about it like it is the need that truly represents what it means to community. Because if you don't have health, you don't have anything. And if you are taking care of a family member that's ill, then that means that you cannot be in the job force to the full extent of your capabilities. If you are someone that's undergoing a chronic condition and don't have access to the medical interventions, it means that your like mental health and well-being also aren't there, and the people that love you and care for you aren't there. And so I think, Aida, this reminds me again that if the president and Christie and Conaway and all of these other people are able to have access to healthcare coverage and, just as precautions, check themselves into hospitals, that should be the right that every American has, because every person that I know is paying more than $0 in taxes every year.
Yep, I agree.
Anything to close out?
No, I mean, I think it is true. We really need to like stay in the fight, and hold these people accountable, and really kind of, even at the local level, I think, look at the determinants of, health, and look at, advocate for parks, advocate for bike lanes, and the development of the city where you live. I mean, I think all that is also part of the advocacy.
Yeah. And since there's so many of us, if everyone gets involved, that means that those of us that feel burnt out, if we all can lean on each other, that means we all lean together, right? Like we can all stand together on this versus it just being a few people that are talking about this. It's time that other people get involved. It's time that people feel part of this process and making sure that this isn't talked about as a want, that this isn't talked about as something elusive, but that this is something that it's like, we want it now because we're paying for it now. We are paying for it. And the time is now to make that change.
Well, thank you, Amparo, for another plática.
Yes. Thank
And
you, Aida.
it's
People
helpful
listen.
to talk it through. And yeah, feel free to email us or, chat with us about this more.
All right. Take care, everyone. Bye.
Bye.